This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Sarabjit Kaur. With me is Vaibhav Jyotsna Srivastav. The headlines. Home Minister Amit Shah reviews operations of control room set up to fight COVID-19 pandemic. Government procures pulses and oilseeds directly from farmers at minimum support price for better returns. Uttar Pradesh government brings back stranded students from Kota in Rajasthan. No decision taken on operations of domestic or international flights yet, says Civil Aviation Minister Hardeep Puri. United Arab Emirates thank India for facilitating first consignment of hydroxychloroquine tablets. In Jammu and Kashmir, Rural Development Department to start various works under MG Narega. Home Minister Amit Shah yesterday chaired a review meeting on control room operations set up by the ministry to fight the COVID-19 pandemic. Mr. Shah reviewed COVID-19 situation in various states with the officers of the control room, took their views and appreciated the exemplary work done by them. The Home Ministry control room is working round the clock and it is not only coordinating with states but also with various ministries of the central government to fight the pandemic. The centre has, in its revised guidelines, allowed certain relaxations in the notified services from tomorrow in areas without hotspots. A series of directives have been put in place to ensure a strict compliance of lockdown. Here's a look at such directives to be followed in workspaces.
As per the guidelines, Defence, Central Armed Police Forces, Health and Family Welfare, Disaster Management and Early Warning Agencies like IMD, National Informatics Centre, Food Corporation of India, Nehru Yuva Kendras and Customs will be functional without any restrictions. Other ministries and departments and offices under their control will function with 100% attendance of Deputy Secretary and levels above that. Remaining officers and staff will attend up to 33% as required. Industries operating in rural areas and manufacturing units of essential goods will remain open. IT and IT-enabled services will be permitted to open with 50% strength. MG Narega work has been allowed with strict implementation of social distancing and face masks. Anupam Mishra, AR News, Delhi.
A total of 14,792 confirmed cases of COVID-19 have been reported in the country so far. Out of these, 2,014 patients have recovered and have been discharged from the hospitals, while 488 patients have died. Briefing media in New Delhi, Health Ministry officials said that mortality rate in the country is around 3.3% due to COVID-19 infection. He said as per age-wise analysis, it was found that 14.4% deaths have been reported in age group of 0 to 45 years, 10.3% in the age group of 45 to 60 years, 33.1% between 60 to 75 years, and for 75 years and above, the death percentage is 42.2%. He also informed that 83% death cases had comorbidity. The Health Ministry officials said that the action taken on the field level is yielding positive results as Mahi in Puducherry and Kodagu in Karnataka have not registered any new case in last 28 days. Besides this, 45 other districts in 23 states have also not registered any new case in last 14 days. The official also informed that 4,291 COVID-19 cases are connected with a single source in Nizamuddin Markaz cluster. Cases which have come up from these sources are found in 23 states and UTs. He said 84% cases are in Tamil Nadu, 63% cases in Delhi, 79% in Telangana and 59% cases in Uttar Pradesh.
23 states में 45 अदर डिस्ट्रिक्ट है जहां पर भी पिछले 14 दिनों से कोई भी नया केस रिपोर्ट नहीं हुआ है. 22 नए डिस्ट्रिक्ट्स 12 स्टेट्स में ऐसे आए हैं जहां पर कि पिछले 14 दिनों से कोई केस रिपोर्ट नहीं हुआ है. अगर इसी तरीके से जिला स्थाई पर कंटेनमेंट स्ट्रैटेजी और लॉकडाउन पर हम काम करते रहें तो हमें लगता है कि हमें इसी तरह के पॉजिटिव रिजल्ट्स आते रहेंगे.
Home Ministry officials said that both the centre and states have started control rooms and helpline numbers for addressing the citizens' problems. She said all states have started state and district emergency centres. She informed that Labour Ministry has started 20 control rooms for addressing grievances of labourers. She added that the new toll-free numbers of the Home Ministry 1930 and 1944. These are for resolving citizens' grievances. Besides, single emergency response number 112 is operational in 29 states and union territories, and police, fire and ambulance services can be availed on contacting on this number.
ये आपातकालीन सेवा लोकेशन बेस्ड ट्रैकिंग या जीपीएस की मदद से पीड़ित व्यक्ति की लोकेशन को ट्रैक करते हुए अतिशीघ्र सेवा प्रदान कर सकती है। कोविड-19 के दौरान लॉकडाउन में इमरजेंसी में लोगों ने इस प्रणाली का काफी उपयोग किया है। गर्भवती महिलाओं ने, बुजुर्गों ने, दिव्यांगजनों ने 112 का इस्तेमाल करते हुए सहायता पाई है।
The official said foreign citizens who are stranded in India due to spread of COVID-19 and whose visas have expired or are going to expire would be extended till midnight of 3rd of May 2020 upon receipt of online application by the foreigner. She said exit of foreign nationals stranded in India, if so requested by them during this period, will also be granted to them up to 14 days beyond 3rd May till 17th May without levy of overstay penalty.
The central government has been striving to assure better returns for the farmers as procurement operations of pulses and oilseeds directly from them at minimum support price (MSP) are underway in different parts of the country. The procurement under the Price Support Scheme (PSS) in Rabi 2020-21 season is currently in progress in Karnataka, Andhra Pradesh, Telangana, Rajasthan, Maharashtra, Uttar Pradesh and Haryana. As on the 16th of this month, over 1.33 lakh metric tons of pulses and over 29,264 metric tons of oilseeds were procured by NAFED and the Food Corporation of India, valued at around 785 crore rupees. It has benefited over 1.14 lakh farmers. During the lockdown period, over 97,000 metric tons of Rabi pulses and oilseeds have been procured under the PSS scheme. Mohammad Qureshi, a labourer from Gandhinagar, received free ration from the government during the lockdown.
मुझे गवर्नमेंट की तरफ से राहत में गेहूं, चावल और शक्कर वगैरह मिला है 3 महीने का, और मुझे कोई भी पैसे लिए बिना राहत में दिया गया है, जिससे मैं गवर्नमेंट का आभार करता हूं और शुक्रिया मानता हूं।
Another beneficiary from Bihar, Jai Kishore Yadav, expressed his gratitude towards Postal Department for delivery of essential items.
पोस्ट ऑफिस का वाहन हमारे यहाँ पहुंचा। गांव के सारे लोगों को बारी बारी से सुबह 10 साढ़े 10 बजे से लेकर और शाम 4 साढ़े 4 बजे तक लगभग सैकड़ों लोगों को भीड़ को इन्होंने कम किया। इस आफत की घड़ी में जब बैंक में कतार लग के लोग दिन भर वापस आते रहे हैं, ऐसी परिस्थिति में इन्होंने सराहनीय काम किया है। हृदय से हम तमाम ग्रामवासी इनको धन्यवाद देते।
Agriculture Minister Narendra Singh Tomar held a video conference with rural development ministers and concerned officers of states and union territories yesterday in the light of the relaxation in non-containment areas from tomorrow. Several developmental works under Mahatma Gandhi Rural Employment Guarantee Scheme, Pradhan Mantri Awas Yojana, Grameen, Pradhan Mantri Gram Sadak Yojana and National Rural Livelihood Mission in such non-containment areas would be initiated under the relaxations given by the central government. Mr. Tomar emphasized that states and union territories should perceive these testing times as a challenge to develop and strengthen rural infrastructure and create employment opportunities. He emphasized that under MG Narega, the focus should be on works related to water conservation, water recharge and irrigation in convergence with the schemes of Ministry of Jal Shakti and Department of Land Resources.
In Uttar Pradesh, around 300 buses carrying hundreds of students stranded in Kota returned back yesterday. State government had sent 200 buses from Agra and another 100 from Jhansi on Friday to Kota, where thousands of students from across the country preparing for competitive exams have been stranded by the COVID-19 lockdown. All the students who have returned to state will be screened and kept in quarantine before they are sent to their hometowns. Students who were in quota for the preparation of engineering and medical entrance exams were appealing regularly to the state government to rescue them as their hostels were being shut and it was becoming difficult to get food there. State government had sent buses along with police personnel to bring them back. The government has clarified that no decision has been taken on operations of domestic or international flights so far. In a tweet, Civil Aviation Minister Hardeep Singh Puri advised the airlines to open their bookings only after a decision in this regard is taken by the government. This came after Air India yesterday announced that it will resume bookings for international flights with travel date from 1st of June following a travel ban on all flights due to COVID-19 lockdown. Air India had also reportedly resumed bookings for select domestic routes starting 4th of next month. The Government of India has reviewed the existing foreign direct investment policy in light of the current COVID-19 pandemic. The new provisions of the policy aim towards curbing opportunistic takeovers and acquisitions of Indian companies. The new norms state that an entity of a country sharing land border with India can invest only under the government route. The policy is also applicable for entities whose owner is a citizen or is situated in any such border-sharing country. For Pakistan-based owners, citizens or entities' investment could be made only under the government route in sectors other than defence, space, atomic energy and other notified sectors prohibited for foreign investment. The new policy clarifies that in case of any change or transfer in ownership of an Indian entity arising because of FDIs from such countries would also require government's approval.
Islamic Seminary in Uttar Pradesh Darul Uloom Deoband has asked Muslims to abide by the guidelines issued by the Health Department, especially during the holy month of Ramadan, and not violate the lockdown rules. The holy month of Ramadan is expected to start from the 25th of April. An advisory issued by Abul Qasim Nomani, Vice-Chancellor of Darul Uloom Deoband in Saharanpur district in Uttar Pradesh, says that COVID-19 is aggravating, which is an issue of grave concern for all. Therefore, the lockdown was extended till the 3rd of May. Talking to All India Radio, Ashraf Usmani, media in charge of Darul Uloom Deoband, said,
जिस तरीके से कोविड-19 रोज अफजू है और अपने पांव फैला रहा है, ये बिला शुबहा तशवीश की बात है और इसके सद्देबाब के लिए मुश्तरका जद्दोजहद जरूरी है और जरूरी ये भी है कि महकमा सेहत की जो गाइडलाइन है उसके ऊपर अमल किया जाए। खास तौर पर लॉकडाउन की पाबंदी की जाए, बाहर निकलने से इज्तनाब किया जाए। रमजान शरीफ तशरीफ ला रहे हैं, इसमें भी इस बात का खास ख्याल रखा जाए कि तराव में जो महकमा सेहत की गाइडलाइन है उससे सिवा अफराद न हो। सोशल डिस्टेंसिंग का उसूल अपनाना और इसको इख्तियार करना अगर जरूरी है तो वो किया ही जाना चाहिए।
In view of the increasing cases of COVID-19 in Saudi Arabia, the Saudi press agency, quoting the Grand Mufti, said that Ramadan's communal Taraweeh and Eid prayers should be held at home as a preventive measure. Saudi Arabia has already suspended group prayers in mosques as a precautionary measure. The kingdom has also asked Muslims around the world to delay their plans for the Hajj and Umrah pilgrimages amid uncertainty surrounding the coronavirus pandemic. Saudi Arabia has registered 1,132 fresh cases of COVID-19 over the past 24 hours, bringing the total to 8,274, a health ministry spokesman said yesterday. The kingdom has also recorded 5 new coronavirus deaths, raising the death toll to 92. This is All India Radio, giving you a special news program on COVID-19. Let's take a look at the headlines once again. Home Minister Amit Shah reviews operations of control rooms set up to fight COVID-19 pandemic. Government procures pulses and oilseeds directly from farmers at minimum support price for better returns. Uttar Pradesh government brings back stranded students from Kota in Rajasthan. No decision taken on operations of domestic or international flights yet, says Civil Aviation Minister Hardeep Singh Puri. United Arab Emirates thank India for facilitating first consignment of hydroxychloroquine tablets and in Jammu and Kashmir, Rural Development Department to start various works under MG Narega. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
The first shipment of hydroxychloroquine HCQ has been sent to UAE, which includes 5.5 million pills for treatment of patients affected by COVID-19. The UAE Embassy in India thanked the Indian government for facilitating the procedures for its shipment on its Twitter handle. Thanking Prime Minister Narendra Modi for sending medical supplies to Kazakhstan to help the country fight coronavirus, President Kasim-Jomart Tokayev has said New Delhi's gesture to help Nur Sultan is a high mark of friendship and solidarity between the two nations. In Uttar Pradesh, the government is strictly managing lockdown for containing of COVID-19 and also committed for people's welfare. Chief Minister Yogi Adityanath has said nobody should remain hungry due to lockdown. The government will provide jobs to the labourers under MG Narega. More from our Lucknow correspondent.
The government has online transferred more than 611 crore rupees in the accounts of more than 27 lakh MG Narega workers. The government has also sent 871 crore rupees in the accounts of pension holders under various schemes. Principal Secretary of Rural Development Manoj Kumar Singh said that the work under MG Narega will be carried out according to guidelines of Union government. The labourers who do not have job cards of MG Narega will be provided to job cards instantly. Chief Minister Yogi Adityanath has instructed for giving wages and honorarium to the temporary labourers and workers. MS Yadav, AIR News, Lucknow.
Union Rural Development Minister Narendra Singh Tomar yesterday held a meeting with advisor to Jammu and Kashmir Lieutenant Governor Basir Ahmad Khan through video conferencing where various issues were discussed. He appreciated the efforts of the Rural Development Department that will soon start executing various works under the Mahatma Gandhi National Rural Employment Guarantee Act, MG Narega. More from our Srinagar correspondent.
Rural Development Department will soon start executing various works under Mahatma Gandhi National Employment Guarantee Act in J&K with due adherence of proper SOP guidelines. The workers shall have to wear masks and maintain proper distancing while carrying out the works. The aim of starting MG Narega works is to give relief to daily wage workers so that they can earn their livelihood through various panchayat level schemes. Meanwhile, the total number of positive cases in Jammu and Kashmir has risen to 341. Sunil Kohl, AR News from Srinagar.
In Gujarat, the total number of COVID-19 cases have gone up to 1,376, with 104 fresh cases reported in the state yesterday. 5 deaths were reported in the state yesterday, taking the death toll to 53. So far, 93 patients have been discharged from hospitals. Meanwhile, Ahmedabad-based Sardar Patel Hospital received a nod from ICMR from starting the plasma therapy. A report.
Chief Minister Vijay Rupani asked the municipal corporation to further strengthen the surveillance in the city. CM also asked all the MLAs and MPs in the city to ensure strict implementation of the lockdown in their constituency. City Municipal Corporation has enhanced the proactive testing. As many as 2,000 samples are being tested on daily basis. Following the nod from ICMR, the plasma therapy will be started at Sardar Patel Hospital. Smriti Thakkar, who was recovered from COVID-19, was the first donor from the state. Plasma therapy will help doctors to save lives of the critical patients. Aparna Khut, AR News, Ahmedabad.
After several days now, some good news has started coming from the state of Madhya Pradesh. The number of cured patients is increasing rapidly, as well as the number of new infections has also decreased. Our correspondent reports that the number of coronavirus cases in the state is 1,402. So far, 69 people have died due to the infection and 126 patients have been discharged from the hospitals in the state.
After Indore, 30 people from Bhopal were also recovered and discharged from the hospital in a single day, while the report of 193 samples of the district also came negative. Director Ajay Goenka of the Chirayu Hospital, Bhopal, informed that a total of 215 patients have been admitted in the hospital, out of which 214 are in good condition. Meanwhile, private doctors and medical workers will also be insured for Rs 50 lakh like government medical workers. Chief Minister Shivraj Singh Chauhan made this announcement yesterday during the video conference. The Chief Minister also talked to many of them and said, "I salute your courage. With the help of you all, we will defeat Corona in the state soon." Sanjeev Sharma, AIR News, Bhopal.
Amidst lockdown, Bihar government has taken decision to restart over 300 industrial units from tomorrow. Chief Secretary Deepak Kumar said those units will be permitted which are situated in industrial and rural areas of the state. Mr. Kumar said works of 82 road projects will also be started. Our correspondent reports that screening of labourers and concerned staffs will be done every day to contain corona infection. In the Maoist-affected areas of Chhattisgarh, the Central Armed Police Forces are engaged in a double task of operation against the Maoists and providing ration to the tribal villagers during the challenging times of lockdown. Inspector General of BSF, J.V.N. Prasad said the Jawans are not only distributing food items to needy villagers and labourers in various villages of Kanker district, but they are taking all possible measures to ensure that this ration should not reach to the Maoists.
बीएसएफ लोगों की सुरक्षा के लिए डिप्लॉयड है यहाँ पर ड्राई रेशन उनको दे रहे हैं पैक करके प्रॉपर तरीके से नक्सल्स मजबूर कर रहे हैं इस कारण से हम अपनी जो ऑपरेशंस है हमने बंद नहीं किया है हम जो रूटीन हमारा एरिया डोमिनेशन है हम कर रहे हैं
Health camps are also being organized by the BSF in rural areas of Kanker district and people are being made aware of ways to prevent spread of coronavirus. Karnataka has 265 active COVID-19 cases and 13 deaths till now. 93 people have recovered from the coronavirus infection. Our correspondent reports that the state is getting its first consignment of 3 lakh personal protection equipment today afternoon and second consignment tomorrow morning. A report.
The state is getting the first consignment of 3 lakh personal protection equipment today afternoon and second consignment tomorrow morning. The protection equipment comprises of face masks to prevent any liquid sprays entering into healthcare professionals to protect them from the pandemic. It also has goggles, N95 mask, surgical mask, coverall suit, shoe cover, apron, gloves, hood and waste disposal bag. Once received, the protection equipment will be distributed to the doctors and frontline staff working with the COVID-19 patients and those under quarantine. Sudhindra, AIR News, Bengaluru.
In Telangana, the state cabinet will be meeting this afternoon at the Chief Minister's camp office in Hyderabad to discuss the lockdown implementation strategies. Meanwhile, the state government has stepped up measures to contain the spread of coronavirus, with 43 more people tested positive yesterday. With this, the number of total COVID-19 cases in the state has gone up to 809. 186 people have recovered so far and 18 have died due to the virus. According to the state authorities, 209 containment clusters have been created and special officers have been appointed to ensure strict implementation of the lockdown in these areas. Tamil Nadu has witnessed the discharge of 82 COVID-19 patients yesterday, while 49 new cases were reported. The State Health Minister, Dr. C. Vijay Bhaskar, told reporters the mortality rate is being maintained well within 1.1%. More from our correspondent.
The State Health Department says the fresh cases are being reported only from within the containment zones. It further says all cases of influenza-like infection, ILI, and the severe acute respiratory infection, SARI, are being subjected to tests to identify if they have the SARS-CoV-2 viral load in their bodies. The Indian Council for Medical Research has cleared the first stage of approval for carrying out studies on the possible use of blood platelets from the cured patients to treat those in hospitals. The government Rajiv Gandhi General Hospital and the state-run Tamil Nadu Dr. MGR Medical University have equipped themselves to carry out the clinical studies. Jai Singh, AIR News, Chennai.
In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Sanjeev Bhoi, Emergency Medicine, AIIMS, said that if a person has common cough and cold and he has not travelled abroad or not in touch with COVID-19 infected person, then testing is not required.
If you have common cough and cold, and if you are not travelled abroad, or you are not in touch with a person who has come from abroad, or you are not in touch with any patient who has this disease, you do not have to worry, or you do not require any testing. Be at home.
Dr. S. Rajeshwari, Department of Anesthesiology, AIIMS, has advised the people to stay at homes and maintain hand hygiene.
We have seen that there is a severe shortage of ICU facilities in the most developed of countries. And in order that we do not face the same calamity in our country, it is vital that we do not stress the health system by becoming more sick and bringing more patients. And for this, I urge that you must stay at home and must maintain hand hygiene to reduce the number of patients coming into the hospital.
Speaking about recovery of COVID-19 patients, Dr. Rajneesh Kaushik, Senior Physician, RML Hospital, says,
मरीज की ठीक होने की रफ्तार बढ़ने का ये फायदा है कि जो एक्सपोजर होता है उसमें बॉडी के अंदर जो इम्यूनिटी आ जाती है, ये है कि इस बीमारी के अंदर वैसे भी 80 से 85% के लोग होते हैं अपने आप ठीक हो जाते हैं। दिक्कत जो आती है हमें 15% लोगों में आती है, जिनको कोई पुरानी बीमारी है, जिनको कोई दिल की बीमारी है, शुगर की बीमारी है, ब्लड प्रेशर है, तो उन लोगों में कॉम्प्लिकेशन के चांसेस रहते हैं। तो रिकवरी के चांसेस डेफिनेटली जो हमारे स्वस्थ लोग हैं, जो सब में चांसेस अच्छे होते हैं। बुजुर्ग लोग हैं 60 से ऊपर, उनका हमें थोड़ा सा ज्यादा ध्यान रखना पड़ता है या किसी को कोई और बीमारी हो।
Human Resource Development Ministry has taken several initiatives to ensure that the education of learners should not get affected due to COVID-19 outbreak. The National Institute of Open Schooling, NIOS, has made innovations in telecast of live session through Skype on Swayam Prabha DTH Channel Parni, Channel Sharda and Channel Kishore Manch. A report.
The learners can watch the lesson-based educational programs on these DTH channels and NIOS YouTube channel. They can watch 6 hours of recorded broadcast from 7 am to 1 pm, followed by 6 hours of live session from 1 pm to 7 pm with 4 different subject experts. Learners can also pose questions to subject experts by calling and through the student portal of NIOS website during the live telecast. These channels are available through all DTH service providers besides DD, DTH and GeoTV app. With an aim to provide quality education, content is also being made available online through Swayam platform of HRD Ministry for various subjects from class 9 to 12. Along with self-learning material, Swayam portal provides video lectures and facility of self-assessment. In addition, for those who do not have much access to internet, these video lectures are telecast on Swayam Prabha TV channels. With Divakar Anand Kumar, AIR News, Delhi.
The Mysuru-based CSIR unit, Central Food Technological Research Institute, CFTRI, has made available high-protein biscuits to the COVID-19 patients undergoing treatment at All India Institute of Medical Sciences, AIIMS, New Delhi. The institute has supplied 500 kilograms of high-protein biscuits and rusks each to the Dietetics Department of AIIMS for the patients. The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Lieutenant General Ved Chaturvedi, Senior Consultant in Department of Rheumatology and Clinical Immunology in Sir Gangaram Hospital, New Delhi, will participate in the discussion.
And now an overview of today's newspapers covering COVID-19 stories. Most newspapers today talk about tightening the noose on FDI. In a bid to curb opportunistic takeovers, FDI proposals to require government clearance, informs the Financial Express. Stricter FDI rules for bordering nations. Taking note of the teaching time lost due to the coronavirus lockdown, the Indian Express states Class 12 course cuts, JEE in June, HRD Minister plans for post-lockdown. The Tribune has an inspiring story of Gurudev Kaur Dhaliwal of Moga City, who is busy stitching cloth masks at her house for the needy people. 97-year-old's mission to stitch masks. And the Times of India states rupees 1,000 fined for spitting in public areas. Similar fine on urination. 3 coupons NDMC to challan violators on the spot. And with the light of hope everywhere, Mail Today carries a picture of Red Fort with the caption, Red Fort, specially illuminated with diyas by ASI on World Heritage Day to express solidarity with the corona warriors of the country.
And now, before we end the special news program on COVID-19, the headlines once again. Home Minister Amit Shah reviews operations of control room set up to fight COVID-19 pandemic. Government procures pulses and oilseeds directly from farmers at minimum support price for better returns. Uttar Pradesh government brings back stranded students from Kota in Rajasthan. No decision taken on operations of domestic or international flights yet, says Civil Aviation Minister Hardeep Puri. United Arab Emirates thank India for facilitating first consignment of hydroxychloroquine tablets. In Jammu and Kashmir, Rural Development Department to start various works under MG Narega. And with that, we end the special news program on COVID-19.